I'm Lizzie. I'm matron for Bow and Morrison wards, and I'm the project co-lead for our trauma-informed care project.
I'm Hortense, board manager and co-lead for the QI project.
My name is Sidra. I'm an occupational therapist. I now work on Limehouse ward, but when the project started, I was on Bow ward and an active member of the project. Thank you.
So our aim was to increase patient and staff satisfaction on Bow ward by 40% using trauma-informed care principles. We realised that actually as a ward there were loads of things that could be improved, and there's trauma present in both staff and service users. Some of the subsections that we focused on were improving staff dynamics and staff wellbeing, racism, and gaining equity in women's health.
I think one of the main reasons why we think this was the right thing to do for our service users and staff was that we did a focus group to get feedback from our service user and staff, and kind of the themes that were coming up were around trauma, racism, and women not having the space to talk about women-related issues, women's health. So that's why we felt that was very important, and we involved the service users from the very beginning of the project towards the end as well. And yeah, a lot of themes came up in our women's group as well, where people also raised that they felt that this was really important to them. And throughout the whole project, we did get feedback from everyone. And yeah, I think it was important to continue receiving that feedback from everyone involved in the project and the service users and the wider team as well.
And there is a lot of things that I want to say that is really important for our female and also for us as a woman, because we did not have the same equity as our male patient within the forensics. For example, accessing the smear test. Most of our females did not have access to smear tests and also to mammogram, and there was no record that will allow those stuff. Then as a team, we work hard to make sure that we have the form embedded on a new form where we can track that record. And also us as a female within the forensic, everybody did not even have access to the free sanitary for our patient, and we fought for them to have that free sanitary exposed at the Oasis shop, because we said that they need to have the same equality like all the male patients. And this is why things have started to change, and we are continuing to fight for our women and also for ourselves, to celebrate ourselves as a woman, because people doesn't have to be scared. We need to go out and shout, advocate for our patient and for ourselves also, that we need the same equality as men. This is one of the things, one of the focus also, that we say that Bow ward is a special place, is a special ward. Being the only female ward within the 17 ward in forensic, this we need to shout out that we have the same equity like other men.